Hi, welcome back for part 2 of COVID-19 coronavirus. I wanted to make a comment about age and how the elderly are the most at risk for respiratory failure, although no age is completely immune, and everybody should take precautions, especially when going into the public. Those with comorbid conditions like hypertension and diabetes seem to be more at risk too, and it may be the diseases itself, or it could be medications that they're taking. Some thought that antihypertensive ACE inhibitors may be the risk, or nonsteroidal anti-inflammatories, the ibuprofens and that class, may be more risk than just taking Tylenol, taking the normal precautions when you take acetaminophen or Tylenol, of course. But so we are trying to avoid nonsteroidals, steroids, just like we would in influenza, if possible, although some of these patients have asthma and COPD with exacerbations and need to be on steroids, and we can't avoid it. With that said, again, always looking at the medications and taking that into consideration, both as risk factors and, again, when we're treating. Mentioned on part 1 how we're giving hydroxychloroquine once patients are coming in with bilateral infiltrates and pneumonia, fever. And we didn't comment on part 1 about fever, but these patients may present with no fever. They could have high fever, but fever itself should not be a determining factor. There's a certain quality to the infiltrates that they're presenting with on x-ray, but we still haven't figured it out. And really all patients who come in with pneumonia that is not community acquired or a typical lobar, or just involving one segment of the lung, or maybe two segments, but this certain sort of what we call ground glass opacities or inflammatory pneumonitis is got a certain look to it, and I saw about 2 of those today. The rest of them that are ruled out seem to be more fluid overload and probably going to be negative. We'll see, and we'll give the updates as we get more rapid testing for COVID-19. And it seems like this week, certainly by next week, there'll be potentially FEMA command center set up and set up to do up to 5,000 tests a day, at least in 1 or 2 sites in the state. Hopefully that'll go through, and the public can get tested rapidly to avoid these patients coming to the emergency rooms. But really, it seems like for the most part, everybody's doing their part and not just coming to the ER for minor things. That would be the recommendation, and to stay home unless you have a progression in a symptom that is more than mild. Of course, anything more than mild now does need to at least get a phone call to the doc or the provider that takes care of you, so that they can at least try and triage you in the best possible way. Most of the practices have websites that are up, and you can go to the website. I know our practice has a website that you can get information. Pretty much every website is updated to have information for both CDC, and the CDC website has the most up-to-date information in regards to recommendations and precautions. So definitely check that out. Hopefully tomorrow is a good day and everybody's testing negative, and everybody is learning how to protect themselves the best way possible, and gowning up, using the masks, using high concentrated alcohol preps to clean and avoid touching others. Even putting a hand on the shoulder right now is people are jumping, and for now it's better to just keep your hands to yourself as a general rule, and keep everybody safe. Have a great night.